Did you know obesity is linked to 5 times the risk of heart disease, stroke, and type 2 diabetes compared to someone who's not obese? So when it comes to obesity, basically people with a BMI of 30 or above, let's talk about what I consider the most important piece of information when deciding between having a weight loss procedure versus taking medications. And that is the effectiveness and durability of the treatment, meaning how well does each treatment work and how long will the medications work versus how long the effects of the surgical procedures last. For me, like I said, this is the single most important consideration when it comes to making the decision between sticking with the medications or going and proceeding with surgery. The latest research we have on the effectiveness of medications such as semaglutide and tirzepatide shows that at 1 year, a person can achieve about 15% weight loss. So for example, somebody who weighs 300 pounds will be able to go down to 255 at 1 year on average. Same person having a gastric sleeve or a bypass will lose about 30% weight loss. So that 300-pound patient will go to a 210-pound weight. And the durability of the treatment for medications lasts only while you take the medications. And also 30% of patients that are on the medications, it pretty much plateaus and it wears off even if you're taking it. So there's a large percentage of people who will plateau, and a large percentage of patients who stop the medications will start gaining the weight back within a very short period of time. Let's look at surgery. At 10 years out, there's still at least a 25% weight loss that people experience, meaning that a 300-pound person who had weight loss surgery 10 years ago will have still kept at least 75 pounds off. All in all, based on the research, bariatric surgery is more effective in both the short term and long term than medications and diet and exercise combined. Weight loss surgery also has an impact on slowing down or stopping the development of type 2 diabetes, high blood pressure, sleep apnea, development of heart disease, and cancer. In the end, it's very important to remember that obesity is a chronic disease and that there isn't just one solution or one way of thinking about its treatment. A lot of times it takes a combination of diet, exercise, medications, and surgery. The end goal is the same: live longer, live healthier.